The first specialty that we'll talk about is nursing informatics. You can become a nursing informatics specialist. What a nursing informatics specialist does is design, implement, and optimize electronic health record. They deal with AI-powered workflows and clinical decision tools. It is fulfilling because you get to fix workflow issues on a massive scale, preventing clinical burnout before it starts. Plus, many of these roles offer hybrid or fully remote schedules. Great for the new mom. The average salary for a nurse informatics specialist in 2026 is between $110,000 and $145,000. How you become a nurse informatics specialist is you need to highlight your experience with major electronic health record. How you get into nursing informatics is on your resume, highlight your experience with major electronic health records such as Epic or Cerner. You can get an ANCC informatics certification, or you can look into an MSN in nursing informatics program, which both will give you an advantage over other applicants. The field itself is booming. Industry data shows that 24 to 28% growth over the next decade. Sorry, this is my cat. Because so many bedside nurses are actively looking for an exit from direct patient care. Hey, Skittles. Say hi. No, I'm not going to do it. Okay. Because so many bedside nurses are looking for an exit from direct patient care, entry-level job openings have a lot of competition. Many openings require 1 to 2 years of informatics or health IT experience. If you've only done floor nursing, your application might get filtered out by automated tracking systems. Highest demand areas right now are in electronic health records optimization, clinical data analysis, telehealth infrastructure, and clinical systems training. To get into this field without an advanced degree, you can become a super user, join a committee, get into a policy or quality improvement or clinical practice committee at your organization. You can also try to get into more basic roles before you become a informatics specialist. Those roles include clinical systems trainer. They educate staff on how to use healthcare IT systems. Electronic health record implementation specialist. They help hospitals or clinics transition to a new software system. Health IT analyst, monitoring, auditing, and optimizing software reliability. You can get an informatics nurse certification. To get the certification, you need an active RN license, BSN or higher, and 2,000 hours of informatics practice within the last 3 years. Keep in mind that tech companies can hire programmers, but they can't easily buy the clinical insight that tells them what is frustrating a nurse at 3 a.m. That clinical perspective is your greatest asset. So highlight that.